Good evening, everyone, and welcome to another edition of the District of Illinois Fireside Chat. I began tonight's conversation with a personal story. In the year 2004, I got a call from my father informing me that he was unwell and that he would be going to the hospital to get a sense of what was happening in his body because of what he was not, how he was feeling. The next day, I received a call from my father informing me that he had to have immediate surgery because they suspected that there was something happening in his lungs that he was unaware of. The next day, my father had immediate surgery, but this time the call did not come from my father. It came from his physician, who told me that upon opening my father, they realized that he had stage 4 lung cancer. And apparently he had been living with this disease for many years and that he did not know it. He didn't know it because he was not getting his routine checkups. My father died 7 days after being diagnosed with advanced lung cancer. The story there is the necessity of getting our annual reports, our annual checkups, because early prevention saves lives. And far too often, Black men are in the category who are not, in fact, engaging in the practice of receiving or attending to their bodies on their annual exams. And more often than not, we discover what's happening in our bodies far too late. This conversation tonight is about breaking that stigma. It is about empowering Black men to gain control of their health and to gain control of their bodies. And so I am really excited about the conversation that we are having here in June in Men's Health Month. This conversation, as a part of the District of Illinois Fireside Chat, is on Black men's health. And we and you are in store for an incredible dialogue this evening. To help facilitate this conversation, I'm going to invite to the stage the District of Illinois historian, Brother Chuck Smoot, to help us get the evening going. Brother Smoot, good evening. How are you?
Brother McKinnis, how are you, sir?
I'm doing well, man. Doing well. I am really, I think Brother Smoot, that this conversation, and that's for Brother Willard Hall. If he's
I knew exactly what you meant when you did that.
This conversation tonight is so important, Brother Smoot. It is a conversation that we need to have even beyond tonight, and that is what it means to care for our bodies and to do the things that we can do to help prevent illnesses that will take us out either too soon or go undiagnosed and we end up passing anyway. You know, Brother Smoot, I believe that we have many reasons to be alive. Some of us are fathers, grandfathers, uncles, friends, and there are communities that depend upon us. And so, Brother Smoot, tonight's conversation on the health of Black men, for me, is one of the most critical conversations, Brother Smoot, that we can be having as men of Alphas. And Brother Will is going to keep tripping me up.
Yeah, he is. But I think you hit on something that's vitally important, that we as members of Alpha Phi Alpha, as men of Alpha, as predominantly Black men, but just men in general, it is important for us to spearhead and engage these conversations because, even though some may just see us as a social fraternity or a service fraternity, looking after our own health and advocating for the health of not only our brothers, those within the fold, but those in the larger community. And I think that becomes very important for us to spearhead conversations like these so we can encourage others to take the steps to protect their own health and to protect the welfare of themselves and their families.
Yeah, thank you, Brother Smoot. I couldn't agree more. And at the outset, the story of my father's own demise. And by the way, Brother Charles Smoot, my father was 43 years old, right?
Mm-hmm.
And at 43, I imagined that, he could have been living a longer life.
Right.
And I tell the story of him not getting his checkups as a reminder to me on why I should.
Right.
And I contrast that as we bring our guest onto the stage, Brother Smoot, with the story of my grandfather, who was diagnosed with prostate cancer in his late 40s. But my grandfather was hyper vigilant about getting his checkups.
Mm-hmm.
His prostate cancer was diagnosed very early. My grandfather today he'll be 97 years old this year.
Wow, that's great.
So, this is 50 plus years
Mm-hmm.
after his diagnosis, right?
Right.
So let me pause and let us get the evening started. I'm going to bring up our health committee chair in the district, Brother Dr. Glenn Miller, and then I'll yield to you. Or do you want everyone to come to the stage now?
Let's start with Dr. Miller, and then let's bring the rest of the panel on. Brother Miller, how are you? How are you this evening?
Greetings, my brothers. I'm doing well. I'm happy to
Good.
be here. I'm very, very happy for this conversation. This very needed and timely conversation.
Absolutely. And I think I do want to, as much as I do want to acknowledge and thank our district director, Brother McInnes, for making this happen. I also want to thank Brother Miller for your leadership in promoting these issues, not just for this event, but for those of us who know or in the district. We do see you as someone who is constantly advocating on behalf of men's health. And for us to take these issues seriously. So I do want to thank you for your leadership and for your promoting of these issues.
I gladly will stand firm in making sure that it's something that's embedded not just within us as leaders, but within Alpha itself since the conception about it. And it really makes sense when you think about it. One of our founding jewels was also a doctor of medicine. He was in healthcare. He was leading Alpha, but he always had his heart and mind and soul, his training in trying to make sure that we are well and make sure that we are better. So it only made sense that within my service into Alphadom, that we continue that because we far too often, especially Alpha men, very far too often are we looking out for ourselves in order to serve well. And that's something I want to make sure that we highlight. I want us to be able to serve well and serve for a longer time, which is what is needed, within our district, but also within this country.
I understand exactly what you mean, Brother Miller, because I plan to be around for a long time reminding Brother McInnes how he doesn't know how to return phone calls. So, and one thing that I hope we will touch on, one thing that I did hear recently, was a treatise on the effect of men and laughter and being jovial and joking with each other, and the health benefits that does have when you can sit up and chop it in with your friends, with your brothers, and make jokes sometimes at others' expense, or even when it's the truth, and how important laughter is. And I think that's one of the things we try to embody with these conversations, as seriously as they are. We do try to, have a little bit of lighthearted humor towards it, because laughter can be the best medicine sometimes.
And Smooth,
actually,
I would just say this is why the brotherhood smoke is the most important part of being an Alpha. Didn't you know?
Absolutely. So, so let's why don't we get ready to bring the rest of the panel over, and we can get the discussion started. As we bring everyone on board, actually, let's start. Dr. Miller, can you give me a brief introduction about yourself and your background, so our audience can understand where you're coming from, and then we will go to Brother Inya, and we'll go to Brother Kelly.
All right. Well, greetings, my good brothers, and all those watching. My name is Dr. Glenn T. Miller. I am a chiropractor by trade, but I am a health and wellness strategist. So my day-to-day consists of working with companies, small businesses, to medium programs, to really help them build out their wellness and or health and wellness programs and protocols. So I love what I do. I get to work with not just our organizations, but others as well, doing things far beyond just looking at our insurance plans and packages, but also making sure that everyone has some type of accountability in their quality of life.
All right, awesome. Thank you. And my good brother, Dr. Inya, it's so good to see you, my brother. You know, you doing okay out there on the East Coast?
Yeah. I am staying safe and healthy. I'm here in DC.
All
Um,
right.
I am saying so as alpha men, we move and think differently, right?
Yes,
And so I am saying that I am meeting the chaos with calm. I am
as
meeting
you should.
I am meeting the chaos with calm and moving in alpha fashion.
Well,
So,
as I would expect, nothing less from you. If you could just tell everyone a little bit about yourself and your background and what you're currently involved in.
absolutely. So I am Brother Dr. OK Enya, a health policy expert with over 15 years of experience in the government space at the local, state, and federal levels. My background is in medicine, public health, and health policy. Um, I am working on my second book currently that we'll probably talk about this evening, called the John Henry Health Equity Playbook, a 4-year health policy agenda for Black men. And I'm super excited to be helping to galvanize not just a moment, but a movement of how do we reimagine the brilliance of Black men and boys, and how do we help to shape policy at the local, state, and federal levels. And so I bring to bear my background as a staffer on Capitol Hill in DC, as a lobbyist, as a scholar activist, as a policymaker, as a bridge builder to ensure that the voices of Black men are heard loud and clear on every platform. I'll note briefly that as Black men, we have to navigate a dichotomy of, on the one hand, being hyper visible in the criminal injustice system, yet invisible when it comes to our health and well-being on policy and research agendas. And so part of my drive and goal is to ensure that as things evolve in this new era, that the voices of Black men are heard loud and clear. I'll also note as well from a personal standpoint that my dad and 3 of my uncles are prostate cancer survivors.
That's awesome.
So
That's awesome.
this is also very personal. And
Yes.
so I look forward to sharing more of my research and my thoughts on this conversation.
All right. And Brother Kelly, now, as the only, as what was mentioned earlier, while you may be a non-alpha, you are still our brother, and we are very happy to have you here to join us for this. So, Brother Kelly, if you could tell us a little bit about your background and what you are currently involved in as well.
Okay, so I am a nurse by trade. I've been in the nursing field for 20 years, and I went back to get my degree as a nurse practitioner. So a nurse practitioner is a mid-level provider. So I work with doctors and kind of like a step above a nurse, where I can function as the primary care provider for a clinic. And so as a primary care provider, I manage people, chronic diseases. I do preventative screenings. And what's unique about that is I work in a federally qualified health center, which is also a school-based center.
Okay.
So as a federally qualified health center, we see people regardless of ability to pay.
Gotcha.
So if a patient doesn't have insurance, that shouldn't be a barrier for you to come in and get your health screenings. So that's basically what I do.
All right. Well, thank you for that. And again, I want to thank all of you all for being here this evening. What I want to start off with is, just talk about, there has been an increase, at least in my opinion, over about probably, I would say, like the last 10, 15 years or so, an increased discussions around looking at improving men's health, particularly Black men's health. And whereas prior to that, there was almost a stigma. While you could, we make jokes about, my back hurts or my knee hurts, but we make light of that. But, other more serious issues, we were kind of at a point where we really didn't talk about that even amongst ourselves. And so the first question I would like to pose to the panel, and anyone can grab this, is what do you think has caused the shift in being able to have, because we wouldn't have 15, 20 years ago, we would not have had this discussion. Unfortunately, even within Alpha. So we see how things are moving forward, but what do any of you see as being an impetus for having these types of discussions?
So I'll lead with saying that that this awareness or this push, I think, is broader than just men's health.
Okay.
When we're talking about mental health, I think with the proliferation of mental health challenges and supports, and what I would see is the destigmatizing of talking about mental health in general. Yes, there are still pockets and there's still challenges in certain sectors of our society when we talk about mental health. However, my point is that I think it's broader than just men's health. Now, yes, at least at the federal level, over the past 15 or 20 years, there have been legislation that has been introduced over the course of several Congresses that has not yet gotten enough into the statutes to have an appreciable impact on helping to support men and boys' health. I actually wrote a blog last year, and I can post it in the chat or online on behalf of the Congressional Black Caucus Foundation that discussed the fact that Congressman Donald Payne Jr., he was the co-chair of the Congressional Men's Health Caucus, which was bipartisan. He passed away from kidney failure and other issues, and he passed away rather young. I think he was maybe in his late 50s or early 60s. So it was just ironic that while he was a champion for men's health, he ended up passing away from issues that could have been preventable.
Gotcha.
Now, I actually have a meeting literally this Friday with a staffer that is working for one of the co-chairs of the current caucus in terms of men's health to discuss these very issues. So it's good to see that there's been some movement in the space. Frankly, for me, because I work and live and breathe this stuff, it's never not going to be enough because
Right.
there's always more work to do. However, it is encouraging to see the recent advocacy by at least 4 Democratic governors to explicitly call out the unique need to support men and boys. And so, for example, our own brother Wes Moore,
Mm-hmm.
Maryland governor, Governor Gretchen Whitmer, Michigan, Governor Spencer Cox, Utah, Governor Ned Lamont, Connecticut, and those have been, as of this year, where they have been intentional about seeing the need to support men. Now, from a political standpoint, it's a good move. Why? Because those that lean right, they knew how to connect with men and boys during this last election cycle, and the data shows that that those that lean right were able to connect in ways that resonated with the men and boys, which helped them to get out to the polls to vote for the person that is currently occupying the White House. So,
Well, okay, and piggybacking on that, Brother Kelly, mentioned within your clinic, have you seen an increase in either those who are coming in, Black men who are coming into your clinic to get checked out, and and following up with that, have you noticed a change in the attitudes towards looking after men looking after their own health?
You know what? I believe so. I think so. I know a lot of brothers come in, and I think social media plays a part in it too.
Okay.
Because a lot of people scroll through the TikTok videos, and they see
Mm-hmm.
different integrative approaches to health. I know a lot of people kind of follow Dr. Sebi's approaches and looking for like holistic approaches to their health, which is great. And so when they come in and I tell them, I said that that's good. And I don't think that we should pit one against the other.
Right.
And I think that we have a tendency to do that.
Mm-hmm.
And then so I just educate them to let them know like how both can be effective,
right,
and how both are needed. And I think that the recent, I don't have any data to back this up, but I just know a lot of people are dying younger of preventable diseases. And I think that tends to scare the men that's coming in. Like, man,
Okay.
my buddy just died of a heart attack and he was 38 years old.
Gotcha.
My brother had kidney failure and he didn't even know it. And he went
Mm-hmm.
to all of this stuff, and they're being more prone to come in and have that initial conversation. And then sometimes their women are pushing them towards me.
Right.
Ladies will come in and get seen, but the guys are like, man, I'm gonna bring my husband. He never went to the doctor before. And then I guess I get a lot of men who was incarcerated who come and see me, and they start that initial health visit. And then primarily we also focus on mental health because that's very, very important.
Mm-hmm.
So I get a chance to talk about like the allostatic load and what that does to the body, and being under constant stress and undiagnosed PTSD and undiagnosed depression that they're affected by, in ways we can get around that and address that. Because as the mind goes, so does the body.
Yeah.
So those are some of the things that I see.
Absolutely. Now, Dr. Miller, within the context of what we're talking about in terms of the increased ability to have these conversations, as I said, you've been championing this from what I have observed, over the last couple of years. Have you seen similar things from your colleagues, within your professional work, who are seeking to advocate similar issues? And how are you working with them, or how are you working with others to promote the message of increasing men's health issues?
So first off, absolutely. And I think it is a combination of what both our fellow panelists were saying. We're seeing a natural progression of men in general, but specifically with Black men, becoming more accountable and taking more ownership based off of the things that we grew up watching. We're breaking away from that stigma, that toxic masculinity that was placed on us at birth. We're learning from the lessons of even our absentee fathers who,
Mm-hmm.
For one reason or another, are they locked up, or maybe they were sick. And we've learned from those, their mistakes, from watching them suffer through their illnesses and disease, as it was shared earlier. And when we are affected by that and have the opportunity to do something about it, we're acting on it. And again, this is contrary towards what the mass media was portraying Black men for the longest of time. As if we didn't care about ourselves, we didn't care about other cultures. We're consistently serving. We're living in a day and age where there are more known fathers at home who are actively trying to be a part of their children's lives than it was ever portrayed before. And in order for us to do that, we have to take care of ourselves. So we are pushing to number one, live longer and be able to do more, with our children. We are actively fighting to do that. And are there organizations that's popping up? Yeah. I recently moved back to the Chicagoland a couple of years ago after doing the exact same thing I was doing in like the St. Louis area. And we were a lot of pop-up shops, barbershop tours where we're doing health screenings, and individual where, Black men are getting together, we're reading books, we're trying to learn on how to heal And I came down here to Chicago, and I found another nonprofit organization where Black men are able to get together and just talk about the trauma that they're going through, the day-to-day trauma, sharing their experiences, like actively connecting with one another, and that helps them heal. And so, seeing that we are in the area because of social media, where we are being more vulnerable with one another, where we're seeing other experiences, where we're watching how men and other cultures are living longer than us. And we have access towards their methodologies and how they're doing better. We're taking advantage of that. You know, we want to make sure that we are feeling better. It's just, as of right now, learning the right tools and learning the right protocols to doing it. And that's where we're at. We're at the moment where we're trying to learn what is the best way to take care of ourselves while still showing up in leadership to others.
Well, and you bring up a really good point that I wanted to address. You know, this whole notion of how we as men, we should suffer in silence. That somehow it's more noble to suffer and be quiet than to think of a complainer or someone who's whining, and how I don't have time, and I can remember hearing young men when I was coming up in the barbershop. I don't have time to go to the doctor. I gotta get my hustle on. I gotta go out and make this money. I'm working 3 jobs. I don't have time to go to the hospital, or I don't have time to do this and so this, and Dr. Miller, you mentioned something earlier about toxic masculinity. And I think sometimes when we talk about toxic masculinity, we're always looking at it from a standpoint of it being external. But in this instance of what I'm asking you guys about, I view it as being somewhat internal, and that we're being toxic against ourselves. So ultimately, my question is, what are the best ways for us as men to support other men to understand that you don't need to suffer in silence? You're not weak for seeking medical attention. How do we combat that?
If I may, very perfect analogy you just gave was that conversation that was held at the barbershop.
Mm-hmm.
And culturally, we know that to be the place that we went there. It was therapeutic. Yes. We were open. We were talking about, hey, I went on a date last night. You know what I'm saying? She was a fine, and I'm tired of working. I've been working these shifts, brother. I got to go get them new J's that's coming out. We're having those conversations as group of men. We have a conversation with strangers that's coming in the door because we have that version of the community. Now, when COVID hit, a lot of that community had dispersed, and it was really hard for us to check in. So we have to become more intentional now with doing those check-ins with we have to get potential with doing those check-ins with our brethren, with our friends, with our cousins, with the other men. We have to be intentional about asking about their well-being specifically, and making sure that we're accountable, making sure that they're following up with the steps that they need.
Brother Kelly, you go on.
So yeah, I just wanted to piggyback and just say that I think that we as men, we just need to bring it to the forefront as well. Just like we talk about the games and the scores of the games, we have to also talk about, when was the last time you got checked, or when was the last time you did that, or how are you feeling? And I know as a provider, I know starting young is very important in the school-based setting. Right. So we start young from 12 years old. Every visit, they get a PHQ where we're looking at, are you depressed? Because sometimes you may be depressed and don't even know what the symptoms are. So are you having trouble with your sleep? Are you irritable? Do you have a snappy attitude? So these are you overeating? And so they say, man, yeah, how long have you been this way? And then we can have that discussion. So we talk about stress. We give out stress cards just to let you know what your stress is and what it is and what you need to do about it. And then if you don't necessarily need to if you don't want to talk to anybody, there's apps that you can have that you can download on your phone. You can take advantage of the mental health that's on the iPhone, that's on the Google phone, and we just need to each one teach one and just like take advantage of that.
Absolutely. So I want to pivot a little bit, and Brother Inya, I'm actually going to focus my next question on you, given your background. I do want to preface this next part of the conversation by remembering that Alpha Phi Alpha is a nonpartisan organization, and the views that are expressed in this episode do not necessarily reflect those of Alpha Phi Alpha, the region, or the District of Illinois. Brother Inya, stop smiling at me. I gotta do the official thing. That being said, and I'm sure Brother McKinnis was with us. He's probably fallen over in his chair whenever I do that. But I'm trying to protect ourselves. But the reality is, we are in a situation that healthcare, from a governmental perspective, and from a legislative perspective, is being reduced, and it is the ability for some people. A lot of people are concerned that their ability to seek quality health care is going to be diminished. As someone who works on Capitol Hill, as someone who has been involved, in the trenches, you've been, the blog posting that you referenced earlier. Obviously, we follow each other on social media. I remember you writing that posting. What is it that the average person can do, particularly if someone is concerned about losing their current health care, whether it's employer based or something else, or if they're on Medicare or Medicaid, of losing that or getting that reduced? What can we do about that, and how can we continue to encourage men to get themselves checked out when we're in an environment where these resources seem to be stripped away from us?
Yes. So let me say a few things. Number one, I was instrumental. So one of the silver linings from the COVID-19 pandemic was the fact that we were able to expand telehealth, which
Mm-hmm.
which actually facilitated opportunity for access to care to be provided for in terms of meeting patients where they are.
Mm-hmm.
And so, which is what I referenced earlier about the proliferation of the tools that are available. Now we're talking about ChatGPT and Gen AI and the ways in which that tool can be used as well. Now, of course, that does not substitute you seeing a therapist or a counselor,
Right.
but it's just an additional tool in the toolbox to help navigate these spaces in terms of access to care. Now, I literally was out yesterday. I was a keynote for a Medical Mondays talk that held space for me to discuss Medicaid policy and the future of Black men's health. Now, literally as we speak, the Senate is debating the One Big Beautiful Bill.
Please don't call it that. I'm sorry.
Right?
I'm sorry. Yeah.
That's a literal title of the bill.
Yeah, I know.
Just to be clear, but in the bill, in the current version of the bill, it is proposing to cut at least $880 billion over the course of a decade from Medicaid,
right,
in a whole plethora of ways. Medicaid covers at least 70 million people across the country.
Right.
most Black people live in the South, and there are 10 states, mostly in the South, that have yet to expand Medicaid since 2014. And so, and as well, most of the worst health disparities are in the South. Um, and so, what we can do is there's always strength in numbers, and it's about, and as someone who has been on both sides of the table as an advocate and a staffer, there if there are ways to engage with the staffers on the Hill or at the state level to collaborate in coalition with other organizations to come up with a legislative agenda with what are the top 3 things during this legislative calendar can we agree to push forward over the course of said period of weeks or months? Because there has to be a shift from this kind of short-term approach to how do you play the long game? And so in a very practical way, what this looks like in terms of, and this is the impetus behind my playbook, is to connect with like-minded people, come up with an agenda, meet with the staffers, have an ask to present to that member of Congress or their staff or that state lawmaker, continue to build the relationships over time, attend rallies, meetings, press conferences, call your member of Congress or your state lawmaker, email them, cover their social media, because politics will impact you whether you wanted to or not.
Right.
And frankly, and I don't mean to sound like crass or not empathetic, but when we're talking about voter empathy, frankly, I'm glad that we are experiencing some level of pain right now for those who lean a certain way. Hopefully, this pain that those who lean either way are experiencing, that'll get them to the ballot box. And so, elections have consequences.
Absolutely.
We are living in the consequences as we speak, as we sit on the precipice of World War III. I mean, like, there's a lot that's going on right now, right?
Right.
And so, but in a very practical sense, it's strengthen numbers, building relationships with staffers at the local, state, and federal levels, playing a long game, engaging with colleagues, having an agenda, and keeping and holding people accountable if and when they get into office, so that those people that do get into office are more likely to advocate for your issues. Why? Because you have done the work on the front end to educate that member or that state lawmaker or that local council member with your unique issues, so that when things are getting challenging or when decisions need to be made, you at least have done your part in that particular season to ensure that when it's all said and done, the vote will go a certain way. So, I know that's a long answer to your question.
No, but it's a needed answer. I mean, I think that was very much an answer that people need to hear, because people need to get involved and understand that they need to get involved. So I appreciate that. I want to pivot to brother Miller or Brother Kelly. Are you concerned with the proposed changes to our healthcare system and our healthcare policy? Are you concerned of how that may affect your particular vocation, but B, how are you concerned of how that will affect the ability to continue to support and advocate for men to look after their own health issues?
Yeah, I am concerned. I don't know how. It's kind of hard not to be. I know we just had the organization that I work for. So I work for the University of Illinois.
Okay.
So within the University of Illinois, we have a community organization. It's called Ocean HP, Office of Community Engagement. And so their funds are going to get hit real hard.
Mm-hmm.
And we have like 80% of workers we work with SNAP, and it's called CPAs, where we go out and educate the kids on nutrition. So they're kind of like, they don't know. And so my boss is saying, man, these kind of some of the same things that Dr. Oki is saying is we need to get out, we need to advocate within the university. We do have a what do you call the lobbyists? We do have a lobbyist that they're kind of working with to let us know what we need to do. And but yeah, I am kind of concerned, and I don't know what it's gonna be like. I don't know what it's gonna mean, but I know we're gonna be all right, you know. But I just tell every individual, like, take advantage of it now. We don't know if it's gonna be here in a year, so you need to come in and get these screenings. You need to come in and get checked out. Preventative health is the key. Exercise, make sure your BMI is okay. Do everything you need to do to prevent any disease from occurring. So yeah, it's gonna be a long road, but I think we'll be okay.
Brother Miller, what about yourself?
That's why I have to stay with my brothers and my soldiers in this field. To be honest with you, I'm not as concerned as they are, because my perspective of viewpoint of health and our well-being is a little bit more different. So you got to understand that my practice comes from a holistic view. And so whenever we work as a chiropractor, and I'm just going to say it plainly, we're more or less seen as like the black guys of the healthcare world.
Gotcha.
Had to fight, everything in order to be legitimate and for people to see, because the idea that somebody can be healing can be facilitated without the use of a medication or surgery was such an asinine thought for a lot of people. But I come from the belief that it's the power that made the body that heals the body. And so when something that hasn't really been serving us well is taken away, we're going to go seek other options. We're going to go look and see what else is there for us. When we had, as explained, that in-person inaction because of COVID, we saw other options and we started looking at telehealth. And more people were making phone calls. They was doing virtual screenings. They were finding out more information. We're using AI more to ask questions about what's going on with our bodies. So if this was taken away, do I think that we're going to be in trouble? Like, no. I think we're going to start learning more about ourselves and how to take care of ourselves. We're going to learn to stop thinking of health as, I just need to go to the doctor and I'm going to be fine. But it's a proactive, ongoing discipline that we must embed within our day-to-day. We have to start looking at the things that's contributory towards our health. And it's more than just, the pain that we feel. You might have to become more of a steward financially. You might have to create more stronger boundaries when it comes towards your social and your and your occupational time. You might have to do more advocating for yourself emotionally. So
Right.
You're going to start becoming a better steward and taking care of yourself so that you aren't worn down so much that you have to become dependent on the institution that we're still trying to fight to help us be better. Right. Comparatively to other parts in the world where they easy access to healthcare and these blue zones where they're living up to like age 80 and 90 and plus. They're not just dependent on healthcare. They have easy access for the checkups, but they're also better stewards of taking care of themselves. So I'm not too much worried about it because we need that chaos. We need to stay calm within that chaos so that we can find better resources that's really going to help us prevail.
I like that. We need to evolve, huh?
Exactly. Exactly, bro.
And that makes total sense. I mean, here's one of my concerns, and I want to throw this out and slightly shifting. So I used to run a Head Start Center on the west side of Chicago. And one of the things, and Head Start gets a lot of people, I don't think even these days don't even understand the benefits of Head Start. But one of the things that is an emphasis in the Head Start program is beginning to teach young children not only about how to look after their health, but ways to eat healthy, and by default, training the parents to get them to do that. And as much as the education piece is important, the future education piece, what I saw with all the things that we had to do, because we had to get regular checkups and we had to get dental checkups and all these different things. And so when I look at the legislation that is coming out that wants to gut or completely remove healthcare, one of my concerns is, in what ways do for us to enforce to children to get them on the path to start taking better care of their health, to start looking at what milestones they should look at as they get older, when they are younger, when they get in their teens or get in their 20s. I mean, we were all 20 at one point and we all thought we were invincible. Everyone thought we were Michael Jordan. But with that, I see, that's another impact that I see from the current legislation that's going on. So in what ways do you all think, and I'll throw this out to anyone, that we can do better about starting to indoctrinate our young people on better ways to look after their health and to take care of their health, particularly, again, our young men who may think they're invisible, may think they don't need to go see anything. But how do we do that if we have those abilities that are being stripped away from us on a legislative basis?
And I was going to share this earlier. This was a great opening. Change starts with us. We have to challenge ourselves to be that good model, that example, to teach our mentees, our children, our grandchildren, etc. I am a big proponent of socio-emotional learning. How can we teach our children, our loved ones, how to increase or improve their emotional intelligence?
Mm-hmm.
How can we model finding the language for their emotions? How do we teach them how to name their emotions, to be able to tame their emotions? It starts with us. It starts with us in terms of, I'll give you my own example. I am literally right now, I have a 20-month-old son. I am teaching him how to do deep breathing.
Okay.
When he gets triggered and has his tantrums, I'm actually trying to model for him how to do that deep breathing so that he can learn how to regulate his emotions. And it also matters, Chuck, to your question of, as the parents, like, we have to be in an emotional space to be able to be that example. So it begs the question of the extent to which we have increased our capacity to regulate our own emotions first, to be that example, and to model that for our children, for our loved ones. Now, I'll also note that because I am exposing my son to stretching and yoga and breath work and reading, etc., he's only 20 months old, but I can see that he's picking up on those things. Like, he's actually doing a little yoga stretch, and he's doing a deep breath. So I see that he's like getting it. And because there was such a gap in the formal educational system in terms of actually teaching these critically important life skills, he's going to be a brilliant leader in school, and he'll be able to learn how to advocate for policies that can help to support other men and boys, because he is literally doing it. He's living it. He can speak to those issues. So, change starts with us being able to challenge ourselves to grow and evolve and to find those spaces that allow us men and boys to be and to be seen and heard and affirmed and validated. And it takes these types of conversations for us as Black men to model being vulnerable and transparent and talk therapy. And it's in that real time experience where change happens. And then to go further, in my playbook, for example, it's how do you translate this lived experience and data into practical strategies and approaches that can help to shape policy at the local, state, and federal levels.
Absolutely. And for Brother Miller, in terms of, piggybacking off what Brother Inya just talked about, but what ways do you have any suggestions for ways to model behavior, inspire those particularly teenagers, early 20s, early 30s, about taking their own health issues more seriously?
Well, I don't know, brother. I'm gonna just tell you right now, a lot of our younger generational brothers are championing, taking better care of themselves, especially when it comes to like emotional stability, emotional intelligence.
Okay.
They are
Okay,
leading the
good.
way. They have solid, strong boundaries when it comes towards what is and isn't acceptable as a man or as a Black man is expressing
Hmm.
themselves. So if anything, I want to continue to encourage that development, encourage that growth, because oftentimes what you find is what you've been living your entire life as a norm, carrying the stress, carrying the weight of your community and how you've been carrying it may have been an improper way for you to do it. And
Right.
as our younger generation are learning from our mistakes, they are willing to share that with us. And it just
Yes.
takes for us to actually listen and say, okay, you know what? Yes, this is a normal for me to, go be in silence and just kind of deal with this pain. But if I can learn a little bit of yoga or a little bit of stretching, or if I can learn how to do that diaphragmatic breathing, I want to reset my nervous systems, then I should.
Right.
I'll say this: every man, every chapter, every organization, if you have to have a financial plan, if you have a service plan, then you should also have a health plan. And you should
Hmm.
be constantly looking at that as you develop. How do I increase my quality of life? What are the important areas in which I need to increase my well-being? How do you measure that? We did some work on this a few years back when we did like an Alpha Protocol, a quality of life assessment. And so you
Hmm.
get to look at, where am I failing at physically, emotionally,
Right.
financially, spiritually? Where are the areas that I need help with? And that's when we become a resource. Like, brother, if you got your social and your occupational well-being and you got that intact, or if I know I need some spiritual work, some emotional work, and I'm just not as strong in that area, I'm calling Brother India. Hey, Doc, I've been stressed out. My quality of life has been real low, and what can I do? He'll share those tactics with me. It's the same
Right.
way, same type of conversation. Check in with your
Hmm.
brother. Say, hey man, I've been in pain for 3 weeks. I wouldn't accept a brother that's old age. It comes with time. Being in pain is not something we're supposed to be in. It's a
Right.
reason why it's painful. It's supposed to tell us that we're doing something wrong. And a
Right.
lot of people are living with failures. We just want to actively be progressive about getting better, and then, taking these tips and trades from one another as we progress forward.
Brother Kelly, did you have anything you want to add to that?
Yeah, just real shortly. I know in my clinic we have something that's called the advisory board. So I work in Inglewood STEM, which is in Inglewood, the south side of Chicago.
Mm-hmm.
And so what the advisory consists of is staff members, the clinic staff, and students primarily. And so we let the students know that this is your clinic. How can we utilize, how do you all want to utilize this clinic? What are you all seeing outside of these clinic walls that needs to be addressed in the schools? Because they know a little bit better than us. And so some of the things they came back is, you know, kids are like not overdosing, but consuming edibles at an alarming rate, and they have to go to the ER. Fighting was another thing. Dealing with anger management was a big. Promiscuity was another thing that they brought up.
Mm-hmm.
So what we did, healthy relationships and goal settings. And so when we took that information, worked with the counselors in the school and worked with the clinic staff in order to create programs that kind of geared towards that. Because I went around to the classes and I talked about edibles and why you shouldn't consume them. And if you do consume them, this is how it should look. Like what we can do instead of taking edibles, what let's get to the base of why are you taking the edibles and what we need to do to address those mental health stresses that you are having in different ways. So advisory board is a great way that we kind of address some of those issues.
Absolutely. All right. Gentlemen, we're going to start wrapping up. This has been a absolutely fantastic discussion. Our esteemed district director, Brother McInnes, is back with us. Before I really start wrapping everything up, Brother McInnes, do you have any comments or questions that you would like to add?
Let me just say again, Brother Smoot, how great this conversation was. I think when we imagined doing this, it was for all the reasons that were mentioned here tonight. I do want to highlight a couple of comments that I heard that I think are worth repeating and ones that we should continue on from the health committee in the district. One, when Mahari spoke about there not being this kind of tension between natural medicine and medicine from your physician, I mean, that cannot be pronounced enough. Far too often, there's this perception that if I am using natural remedies, I can't, go to the physician, I can't take these medicines. But there's value in both of them. And I think he made that very clear tonight that we should not see these things as polar opposites, but how they can work together. And oftentimes, Mahari, I've often told even family members, sometimes we need the prescription to bring things to a good level. And then we can start using the natural remedies as a way to maintain the kind of health that we're trying to maintain. And so I really appreciated that. Brother India and his gesture toward how we should not allow what's happening at the federal level cripple our abilities to be stewards over our bodies in these times is so important. It's easy, I think, to walk away from. I think about Dr. India. For y'all who don't know, Dr. India is.
Here we go.
He's my profile. He made me.
Okay, this is all your fault.
And he is the same way he was when I was online. Trust me, But when I was going through my membership intake process. But to that, Brother India, this reminder I was going to say during COVID, I remember hearing so many people being afraid to go to the physician because they were afraid of getting contracted with the virus. They didn't want to step foot near a doctor's office. Yeah, there are some people who went years without a mammogram, who went 4 years over their prostate exam, their colonoscopy, and then 4 or 5 years into the pandemic, people get some really bad news. And so I appreciate the message that you gave tonight, that in spite of what's happening, whether it be policy, whether it be natural things of the world, being stewards over our body is our responsibility. And that was kind of the point that you left us with tonight, at least in part of your comments. And then finally, Brother Miller, I have seen my physician in front of my face go to AI. This conversation between the relationship between technology and medicine is super important. One, it shows us the ethical ways that artificial intelligence can be used, right? I mean, this is an important conversation that needs to be had because artificial intelligence can be used negatively and it's often used in ways that it shouldn't be. But there are ethical standards toward using artificial intelligence, be it your physician or even us having access to artificial intelligence, to ask questions about our health. I know, for instance, Brother Miller, there are these AI body scans, right, that they promote in medical offices that can scan your body and can give you a sense that something is going wrong, right? I only knew, thank the Lord, I'm no longer suffering from this, but I only knew that I was on the verge of sleep apnea because my Apple Watch caught my breathing at night, right?
Mhm.
And it sent me the indicators that I was too far, right, above where you should be in terms of breathing interruptions. And so, again, I appreciate so much of what was said tonight, and I cannot thank you enough, Brother Smoot, for facilitating this conversation. I hope the brothers who watched it live and who are watching in the aftermath will really take heart. I think there has to be a part 2 to this, by the way, Brother Smoot.
Absolutely.
And
Absolutely.
focus perhaps on targeted conversations. But
Uh,
I will yield there. And thank you, brothers, from the bottom of my heart for your time that you've given the District of Illinois and the broader public tonight.
So I just want to do as we get ready to end, I just want to give everyone a quick 30 seconds to give a parting comment, a piece of encouragement, whatever you would like, but keep it about 30 seconds or so. Just whatever your parting comment would be. Dr. Inya, my good brother, even though all of this is your fault, you brothers, I don't know about y'all. But that being said, Dr. Inya, if you could, give us a brief parting word.
Yes, thank you so much. Of course, I'm honored and I'm always proud, when I see my good brother, Dr. McInnes, leading in ways that are enriching. And I'm just so honored to live in this kind of full circle moment to be able to see Leonard leading this way. So I want to just, say that
Absolutely.
In public. So I'll just briefly say that, look, yes, Marcus Mew. Politics. So all politics is local.
Right.
And politics will impact you whether you want it to or not. I want to let that sit. Like, whether you choose to engage in the political making process, in the civic engagement process, is going to impact you. So the question becomes, what is the extent to which you will engage in a process to ensure that that outcomes will fall in your favor? I'll just cite one thing. I have found, and my colleagues have found, that there is a direct correlation between the extent of a resident's or a voter's level of civic engagement and physical and mental health outcomes, which begs the question of, again, if you are more likely to engage in the political making process, given all that entails, it bodes better or well for you in your physical and mental health, and perhaps other ways. So I'll close by saying that politics will impact you or us, whether we want to or not. Please vote up and down the ballot this year and going forward. Up and down the ballot every year. Thank you.
Excellent. And I do want to say, Brother Inya, I do want to thank you again. Every time we have called on you, this is about your third time appearing with us on one of these fireside chats. Every time we have asked you, you have been very gracious and you've been very informative. So I do want to thank you for your continued support of the District of Illinois and what we're trying to do here. So I do want to thank you for that. And even if you are from UMU. And so, Brother Kelly, any parting words that you'd like to have?
Thank you, gentlemen, for letting me come and be a servant. Thank you for giving me the opportunity to sharpen my sword. Only thing that I would just say, if we can all just go through our contacts, send a text to all the men that we know, let them know this is Men's Health Month, and get those preventative screenings, because a lot of times they're asymptomatic. And
absolutely,
yeah,
absolutely. And brother Miller, as our
Brother Smoot, I'm sorry.
Yeah,
Brother Smoot, Mahari, can you once again just say for the brothers who might be on the call in the public, who might not know where they can get access to healthcare?
That's a great point.
Not have access to, through their job, whatever. Where can anyone show up to get these preventative measures that we know are life-saving? Can you just speak to that very briefly before we depart? And if you can, and then we'll also spread that information out, by the way.
So wherever you are, you can just Google federally qualified health centers. So they're spread out throughout the communities. The one that I work for is called Mild Square. It's the UIC. The email is, the website is mshc.uihealth.care. Again, mshc.uihealth.care. And we see people regardless of ability to pay. You can come in and get those screenings, and we'll square your way.
Awesome. Thank you. And thank you for reminding us of that, Brother McInnes. Our district health director, give you a couple of parting words.
Man, I look forward for more conversations like this. This is always amazing, but it's even more so encouraging when I see other leaders, Black men who are leaders, who are looking out for our health and our well-being. So I'll part with this. Health isn't just about having a six-pack. Right? It's about having peace. It's about having purpose. It's about waking up and feeling good in your body and in your life. So Black men, we are doing such an amazing job at seeking better health and reclaiming our rights to be well. I want to make sure that you are reminded that a ship isn't soft, it's sacred. A weakness is not a part of us, it's warriorship. So remember to return to self and work on restoration of your whole being. Thank you again for this moment. And again, I'm looking forward for the next conversation.
Well, thank you for your leadership, Brother Dr. Miller, Brother Dr. McInnes. Thank you again. This has been a great discussion. I do absolutely think that we should revisit this sometime in the fall, particularly when it's time for kids to go back to school, and as the seasons change, to remind people about that. And we also should look at doing a pointed discussion around men's mental health, because there are a lot of issues surrounding that as well that we can focus on. But in the meantime, I do want to, on behalf of the District of Illinois, thank you all. This has been a great discussion. For those who are watching, don't forget to hit like and subscribe. You can see our other fireside chats that we have on our YouTube channel, whether we've talked about history, whether we've talked about religion. We've talked about so many different issues that our goal here is to create conversations and create an avenue for people to get information that maybe isn't always as accessible. So hit that like button, hit that subscribe button, so you can keep up with us and watch our previous episodes, and stay tuned for the things that we have coming. So on behalf of the District of Illinois of Alpha Phi Alpha Fraternity Incorporated, thank you all, and thank you all for tuning in, and we will see you next time.